Your CNOS Health Watch on Siouxland News.
When is it just a bump on the head or something worse? Siouxland News reporter Katie Link went to CNOS to find out.
We are being a lot more conservative and pulling our athletes out sooner and making sure they're 100%.
Michael Nguyen is a primary care sports medicine doctor at CNOS. He says you're much more likely to have another concussion after suffering the first.
When you have these concussions back to back, you can have massive amounts of symptoms, longer term sequelae in terms of headaches, dizziness, fatigue, concentration, that instead of lasting only 7 to 10 days, go out months, sometimes even years.
To help combat this problem, there is a national return to play protocol,
which mandate no return to play the same day that you suspect concussions, as well as having an evaluation before you're allowed to return.
Other treatments include resting by actually taking a mental break.
Resting the brain is important, but taking them out of school, allowing work to pile up while they're gone, and then they return, that increased amount of work and stress also causes some stress to the brain.
It can be hard to know when you're healed from a concussion, but exercise can help.
When your blood pressure is increased, the relative blood pressure in the brain is increased, and when the brain is damaged, they can't tolerate that increased blood pressure. So usually that's one of those markers we can use with our athletes to determine when they've overcome or healed from their concussion.
Whether you're an athlete or not, concussions can affect you, and it's best to know what to do.
The most important thing to take away is that recognizing the symptoms of concussion and then doing the appropriate steps to manage your symptoms and get you better and healthy so that you don't fall into these categories of having repeated concussion or lasting symptoms.
For Siouxland News, I'm Katie Link.